What is the LEEP procedure for cervical cancer screening? Imagine a simple, quick procedure that can help catch cervical cancer early and even prevent it from developing. That's what the loop electrosurgical excision procedure, or LEEP, is all about. It is a medical technique used to remove abnormal or precancerous cells from the cervix, which is the lower part of the uterus. These abnormal cells can sometimes turn into cervical cancer if left untreated, so catching and removing them early is key. During a LEEP, a healthcare provider uses a thin wire loop that carries an electrical current. This wire is carefully passed over the cervix to cut away a small layer of tissue that contains abnormal cells. The tissue that is removed is then sent to a laboratory for detailed examination. This helps confirm whether the cells are precancerous or if there is early-stage cervical cancer. The procedure is usually recommended if screening tests like a pap smear, colposcopy, or biopsy show moderate to severe abnormal cell changes, known as cervical intraepithelial neoplasia, or if a high-risk human papillomavirus infection is detected. The LEEP is typically performed right in the doctor's office and takes only a few minutes. Before starting, the patient lies on an exam table with legs in stirrups, and a speculum is inserted into the vagina to expose the cervix. Local anesthesia is used to numb the area, making the procedure comfortable. Sometimes, a vinegar solution is applied to highlight abnormal cells. The wire loop is then carefully passed over the cervix to remove the targeted tissue. Afterward, a special paste or electrocautery may be used to control bleeding. This procedure plays a vital role in preventing cervical cancer by removing cells that could develop into cancer if left untreated. It also provides tissue samples that help doctors determine how severe the abnormality is or confirm early cancer. While LEEP is generally safe, it does carry some risks, such as heavy bleeding, infection, or rare complications in future pregnancies like premature birth or low birth weight. Sometimes the cervix may narrow after the procedure, which can affect menstruation or fertility, but these are uncommon. It's important to note that LEEP is usually avoided during pregnancy and may be delayed if there is active cervical inflammation or infection. Scheduling the procedure when not menstruating helps ensure better visualization and accuracy. Overall, LEEP is a crucial tool in cervical cancer screening and early detection efforts. It helps remove abnormal cells before they can turn into invasive cancer, aligning with medical guidelines for cervical health and prevention. If you have abnormal screening results, talking with your healthcare provider about whether a LEEP might be appropriate for you is always the best step. Remember, early detection and treatment can make a significant difference in health outcomes.